Hey everyone, this is my case presentation on CVA. This is actually a true story. I feel like I usually make things up, so this one's actually real. A 93-year-old female presents to the ER with sudden onset dysarthria, aphasia, and right-sided hemiparesis just 15 minutes prior to arrival. Pertinent medical history includes hyperlipidemia, non-insulin dependent diabetes, and atherosclerosis. Upon assessment using the National Institutes of Health Stroke Scale, the patient scores a total of 11 points. An initial head CT is negative for hemorrhagic stroke, but does show an occlusion of the left middle cerebral artery. Her blood pressure is 180/92, but her vital signs are otherwise normal. Blood work is drawn for troponins, coagulopathy, CBC, lipid panel, and BMP, and an EKG is performed, which are all unremarkable. She is administered a newer clot-busting medication called tenecteplase, or TNK, and monitored for signs of bleeding. Carotid duplex imaging shows bilateral stenosis and 90% occlusion of the left carotid artery. She is admitted to the neurovascular ICU on bleeding precautions for 24 hours and with plans to stent her left carotid artery in hopes of preventing further ischemia in the future. Per neurology, her systolic blood pressure is maintained between 140 to 170 to improve reperfusion to the affected area. They also order neurovascular exams every 2 hours and a repeat head CT scan in 24 hours to ensure that the area of ischemia does not convert to hemorrhage, though this is less likely with TNK than TPA.